Hello everyone, today I'm going to show you how to transfer patient from bed to wheelchair, from wheelchair to bed, dressing and undressing, and transferring patient from bed to stretcher. Let's go! Having a careful preparation for your duty is a must. Begin interaction with patient by doing the standard operating procedure, such as hand washing, knocking the door, introducing yourself, verifying the name of the patient. Make sure to address the patient by name as friendly greetings, establish rapport, and provide privacy and explaining the procedure that you're about to do to your patient. And make sure that your patient understands the procedure before doing it. So now, let's transfer patient from bed to wheelchair. Position the wheelchair next to bed facing the foot of the bed. If possible, brace the wheelchair against the wall or solid furniture to keep it in place. Next, fold the top linen downwards and position the patient into side-lying position by crossing the leg, placing the hand in the abdomen and the other hand in the bed to provide support. Help the patient to swing his foot out of the bed and give her assistance in getting up. Then, allow the person to rest for a minute before helping him or her to stand up. Next, lock the wheel of the wheelchair and position the footrest out of the way. Help the patient to stand up by placing your hand on her back, positioning your feet alongside with her feet, and flexing your knees to block her feet and keep her knees from backing as she stands up. Remain in that position while walking until the leg of the patient touches to the edge of the wheelchair. And assess the patient to feel comfortable in the wheelchair and you're ready to go. And now, let's transfer patient from wheelchair to bed. Now, move the footrest out of the way. Place your hand at the back of the patient. Avoid placing your hand in the patient's axilla as this might cause injuries to the patient. And now, ask the patient to put her hands to your shoulder and help her to stand up. And proceed on walking until her legs reach to the edge of the bed. And help the patient to lie in bed and assist her in adjusting to find a comfortable position. Then, put the blanket on. Additionally, you can use transfer belt but we don't have available, so we transfer it using our bare hands. So now, let's proceed to undressing and dressing. So what we need here is a clean blanket and a clean gown. Place the blanket on the top of the patient and fold it and cover the patient for her privacy. Ask the patient to hold the blanket as you remove the gown. Carefully untie the back of the gown and firstly remove the gown in the weak hand if there is any, follow into the other hand. Then, remove the gown downwards to ensure that the blanket is covering the patient's body. Next, place the clean gown on the top of the patient's body. Tie first the back of the gown. Just easily wear that in the head of the patient. Next, insert first the weak side of the hand, if there's any, followed by the other hand. Then, slowly remove the top blanket and return the blanket of the patient on the top of her body. And yes, we're done in dressing and undressing. And now, let's proceed in transferring patient from bed to stretcher. In doing this procedure, you need 3 workers to carry the patient. Move the stretcher near to the bed and make sure that the wheels are locked. Then, remove the top blanket of the patient. And roll the leaf sheet as close as possible to the patient's body. Then, in a count of 3, move the patient to the edge of the bed and change your position to safely lift the patient's body to the stretcher. And then, in a count of 3, transfer the patient carefully. Then, put the blanket back to the patient's body. And we're done! Thank you for watching. I am Gelivie Richa Basibasi, your student nurse.